designers, we can definitely design communication interventions, no, at that parang at designed specifically for private schools. On the other hand, so yung experience din naman na definitely for communicators, partnerships, no? So if not at the national level, with other CSOs and maybe other organizations, no, that do the same, immunization specific campaigns that target private schools and also their parents. And then siguro at a broader level, no, more public facing campaigns, not necessarily tied to schools, but more captures a more not necessarily general, but a bigger audience, not limited to the spaces of of schools, no. It can be, social media nga is a very powerful tool that captures a much wider audience. So if there would be, like, let's say sa experience namin of funders that would fund like public social media campaigns on vaccine confidence, so wider scope and reach of IEC materials. So that would also be a good opportunity to capture bigger audiences that includes children or learners, adolescents, parents, and even educators. Definitely, we can tailor fit that naman. For us in Evident and for other communicators also, usually we will support any initiative that's available, though, that focuses on these behavior change activities. Thank you.
Thank you, Dab, for that. And for Dr. Miko, is there any way to perhaps have a touch point with the private school so that they can be included in the rollout as well?
Yeah, it's a tricky situation lang here in DepEd, no? Given that the nature of DepEd for with private schools is mainly regulatory and supportive as needed, no? But nevertheless, we still do work closely with a lot of associations representing private schools, and we'll see how we can further strengthen and deliver support to these types of schools. I guess similar to what Dr. Alvin mentioned, a lot of the demand generation is also dependent on the supply. And from the side of DepEd, no, we also rely on what the DOH purchases for school-based immunization. So within DepEd's capacity, we don't have the vaccines ourselves, no. So there is a big elephant in the room that we have to acknowledge, but I think it's out of the scope amongst all of our panelists today. But nevertheless, parang working with private schools, that's definitely something that we can offer as a form of support, given that we're also ramping up and driving up learner support. So we hope to package this to our existing platforms where we engage with private schools so that we can provide the support from our office on how we can increase the demand from their side.
Thank you, Dr. Migo. And we look forward to the developments on that aspect. For Dr. Alvin, yes, going back to your concern regarding the vaccine supply and providing a more rationalized distribution across the target or eligible participants in Los Baños. Is there also any form of collaboration or rollout across private sector as well in Los Baños that you are looking at? Nakamute po kayo, Dr. Alvin.
Sorry, okay. Okay, sorry. Well, yeah, you're surprised that most, I don't know, most of the pediatricians do not offer HPV vaccine. And they say that it's the OB-gynecologists who are offering the HPV vaccine. Then the question is, these 9 to 13 years old, they do not usually go to the OB-gynecologist. They are supposed to be in the pediatric care. So there's really a possible gap in the care of this age group. So we really have to address this. And with that, I'm hoping that the SBI, the school-based immunization, will be extended to the private schools because we might be assuming that these kids in the private are going to the private pediatricians, but you know, baka they're not the ones who are vaccinated because they are usually not being or they do not see the pediatrician at their age. There's a question here in the chat that um, why are NCR there are oversupply of vaccine. I'm surprised. Is this true that there is oversupply of HPV vaccine in NCR? It is my understanding that it is a national problem. The vaccine limitation is a national problem, and it's not isolated to uh, limited LGUs. Um, is this true, Dr. Neat, that NCR have enough supply of HPV vaccine?
Apologies, Doc. I won't be able to comment given that that's mostly within the purview of the Department of Health.
Okay.
Hi, Doc. Maybe I can chime in, but based on our engagement with the local government units in Metro Manila, they're also experiencing some sort shortages in the vaccine supply. So perhaps we can look into that information, Doc. Maybe there's a later more relevant update regarding the vaccine supply for this year, because we remember one LGU mentioning that they're also preparing for the upscale of the vaccine rollout for the upcoming school year. So
There was there was a mention initially before that we should be using, in LGU, we really have the GAD fund. And it's actually a source of fund. But, there are other programs that are being charged to GAD fund. So, like, for example, if we have 1 million pesos allotted for HPV vaccine, so I think the price for HPV vaccine now is 1,500, right? So if you're going to buy HPV vaccine with 1 million, that's only around 600 doses divided by two. So that's around only 300 plus recipient of HPV. Now, in the case of this virus, we have at least 10,000 target population. Um, that's a very low uh, that's a very low number of vaccine for a target. So I think it's really it should be the DOH that should be handling this vaccine, really, like the other routine vaccination in children.
salamat po, Doc Alvin. Now, just going back to some of our questions relevant to the communication strategies. So this question is addressed to Dove. So just circling back on what you mentioned about trust building, relational consistency with stakeholders, and putting youth at the center of the co-development. So based on your experience, how can we strengthen co-creation approaches with young people while ensuring messages remain accurate, evidence-based, and contextually appropriate?
Alright, thanks Danica. So, actually ano pala, parang one of the things 'no that I forgot to mention earlier 'no is yon parang what is to the question of anong klaseng optimal relationship and role assignment 'no yung parang magkakaroon because of course in all communication in all our communication campaigns, 'di ba, we have a lot of different stakeholders with a lot of different roles. So for us, our experience, no, is that the role for the youth usually, ang toka nito at ang how we get their insights and how we build trust with them, first of all, is parang meeting them where they are. So through the community stakeholders that they trust, syempre we're coming in, 'di ba, as parang as a new group or as a new person. So we will access them through organizations or community members that they already trust. And for them, the role would be typically, to generate the insights and the language, and then especially yung cultural nuances, and then other types of context, no, cultural, religious, political if meron. So yun kasi yung mga small things, no, that um I guess that also get us those unexpected ideas of how we can ensure that campaigns, messages, content, whether it's IEC, it's videos, will be resonant with them. Pero importante na sa kanila mismo nanggagaling yung insights on what is effective, what would work, what type of language they're very receptive to, and so on. And then, syempre, for us, and of course for our panelists, no, who are considered the experts, and making sure that things are evidence based, factual, and still up to date yung information. So ang role, they will be the ones that are ensuring, no, that the science is sound, that the information is correct, and that we're adhering, no, to certain ethical standards and other standards, no. So yun naman yung role nila. And then lastly, so for me or for Evident, no, as communicators, kami yung nagbe-bridge, no, of nung dalawang parang I guess levels of information na yon. So from the youth and then from the experts, and all together as we co-create campaigns, then ideally, no, that addresses yung concern of keeping it fun, parang edutainment nga, kumbaga, it's educational, yet entertaining and effective towards our audiences. So, yan.
Thank you, Doc. Is there like any systematic process as to how we do co-creation with this set of stakeholders, or it differs depending on, for example, the stakeholder category or the age group, for example? Is there like a specific framework or systematic approach on how we can best approach co-creation process?
Okay. So, very broad lang din naman kasing ginagamit, typically, no, it's human-centered design na framework, no, that while of course we have the data, the research, parang the theories, of course it's gonna resonate kasi 'di ba deeply, differently, no, on the ground or to our end users or to our stakeholders. So parang the process is really, well, triangulating, no, the two, the evidence and then the real world experiences, and then that's where it comes in. It's typically simultaneous, no, or very sabay sila at the planning stage pa lang. And for us in Evident, that's also mandatory na you can't have one without the other. And even at the for parang succeeding stages, no, let's say nakapag-planning ka na at the planning stage, definitely when you produce, let's say, an IEC material, kailangan mo pa rin siya i-pretest, 'di ba? To check if effective ba, and if resonant ba siya, and this would be good for public release. And then at the end, at the monitoring and evaluation, kailangan mo pa rin 'yan, 'di ba? To see if effective ba yung messages ba ay were received well. And most especially, no, syempre we have typical campaign metrics, yung medyo mababaw, like there's reach, there's engagement, there's media values. But beyond that, yung lalim talaga, parang how were you able to affect mindset change, attitude change, and also yung behavioral shift. So in the context, no, of immunization, meron bang mga self-reported conversations initiated among peers dahil nakita nila yung mga communication materials natin, 'di ba, that encourage HPV vaccine uptake. Yung mga parents ba nagpipirma na ng consent form kasi mas knowledgeable na sila kasi nag-comms campaign tayo. And then of course, ultimately, no, are there individuals na finally after the campaign, nag-take up ba sila ng vaccination? Lumapit ba sila sa health center para magtanong? And as a community, mas marami bang conversations happening? And are they the ones teaching themselves or educating themselves about vaccination, no? Not just HPV, but I guess vaccination in general. So yun yung, I guess, the human-centered approach that we take, that they are at the center of all the stages and you can't leave them out of any of those parts.
Thank you, Dov. So in relation to that as well, this question now is directed to Dr. Migo. You mentioned a while ago that you have various strategies lined up under DepEd to intensify not only the HPV vaccination rollout, but also various health programs that are school-based. So aside from the ones that you mentioned earlier, are there any future communication plans under DepEd that are lined up to strengthen the program together with other agencies, particularly the DOH? And what support is needed from the parents, teachers, and civil societies?
Hmm. Okay, communication strategies. Siguro what I will mention, no, in line with the health promotion framework, which emphasize settings-based approach, something to be expected is our commitment to the universal healthcare law, which is how we prescribe standards for creating healthy learning institutions. So that is something that we are currently developing, and I guess in a way, it will result into a communication strategy because we are promoting the school as a health enabling environment with the delivery of school-based health services as a critical component to it. So if you as a school leader, as a in charge of making sure that the environment of your school is health enabling, assure that immunization is delivered to the targeted grade level learners, or if you even expand it through your own proactive initiatives to look for partners who will support your own school-led initiatives. That's something that we also want to recognize and incentivize, and it's part of how we can not create a competition amongst our schools, but really take the onus of making the school a healthy environment to the hands of our capable school leaders, because health and education go hand in hand. You cannot expect a learner to get the best of their classroom experience if they come to school hungry, if they come to school with a lot of vaccine preventable diseases, if they come to school in a not in a good state of well-being, no? So it's really making sure na the physical school environment, the social school environment, your school policies, the essential learner support services, what I mentioned, no, which will also include sports, school clubs and organizations, child protection mechanisms like teen centers or guidance counseling offices. No, those are all important pieces to the puzzle of keeping our learners in a good state of health and well-being. And that's something that school heads and school administrators need to value and understand as a parallel or equal effort to the educational experience, the classroom experience that our learners do on a day-to-day basis, no? So that's something to be expected, and how we really want to own up to our commitments to universal healthcare, na all of our schools become health promoting environments. So the healthy choice, if not default, it's easier to do for all of our learners.
Salamat, Doc Migo. So I believe that's the last question. Wow, it's a very fruitful discussion that we had during this panel discussion about learning about how we address the demand side. For example, the health workers, in terms of addressing it by a rationalization plan. In terms of the vaccine supplies shortage, which we aim also to tackle, hopefully through advocating it through with the Department of Health, addressing also the supply side by establishing trust and relational consistency, integration mechanisms of healthcare services during vaccine rollout, and even having a communication strategy to tailor fit the messaging strategies based on existing local evidence and inputs from various stakeholders through co-creation process. And there was also mention about having school ownership from planning and conceptualization phase, because once and for all, it's about the overall welfare of the youth, of the students or the learners. So in summary, effective HPV communication really comes down to everyone working together: schools, health workers, and communities speaking the same language. Messages need to be clear, consistent, and sensitive to people's concerns. Youth should be involved in health programs, including communication activities, starting at the design stage. On the ground, what works are simple, school-based approaches, such as the peer-to-peer parent-teacher meetings, referrals to adolescent-friendly health facilities. For young people, it's not enough to just not talk to them. We need to work with them, co-create messages, and meet them where they are, especially online. So as we come to a close, we have the honor of Dr. Panelo, President of the Foundation for Advancement of Clinical Epidemiology Incorporation, to give us the closing remarks for the event. So Dr. Panelo. Dr. Panelo, you're on mute po.
Hi, sorry. Can you hear me now?
Yes po.
Hi, thank you, Danika. Magandang hapon sa inyong lahat. Una, nagpapasalamat tayo kay Director Migo, kay Ma'am Love, and kay Doc Alvin for expertly addressing our many questions during the panel discussion. And I also appreciate the active participation of our audience. I can feel your passion and concern about the topic, not only on vaccination per se, but the broader concerns of the health sector in general. Before I proceed, I'd like to greet all of you a happy World Health Day. And the 2026 World Health Day is actually aptly themed, which is Together for Health, Stand with Science. Without mentioning anything, I guess it's obvious that the Stand with Science phrase is particularly referring to the attack on vaccinations in particular, starting from the time of the pandemic and continuing until now. And for every generation, vaccines work is a very appropriate theme as well for our discussion today, because that is what the science is actually telling us. And so I really appreciate having you all together today. I'm sure you had an exciting discussion. And from judging from the drift of the discussions with the panel, I appreciate the broad concerns across the implementation of HPV vaccination, from generating demand all the way to delivering the services itself and looking for the platforms. I found the inputs from our panelists particularly very insightful. And this is what I like with this project, because you're actually implementing something and testing various approaches how to um, increase the utilization of HPV vaccination using available community platforms, including schools. But your discussion also touched on very important concerns, like the ability of the Department of Health and local governments to cover the logistics, meaning making sure that the vaccines and the supplies are available and the people who will administer the vaccines are there. And I was particularly struck by the issue of having too few vaccines actually, and how to deal with your communities, and explaining that not everybody can be administered with the vaccine. On my end, as an economist, my bias is really in thinking, if we're unable to implement this at scale, will HPV vaccination be as cost effective as we actually imagined it when we're aiming for herd immunity levels of coverage? And that's a question that we need to answer at the macro level, while the pilot also deals with meso and micro concerns in implementation. So in closing, I'd like to thank our partners, the UP National Institutes of Health, Institute of Clinical Epidemiology, Health Promotion Program, particularly the UPLIFT Adolescents project, and the Alliance for Health Policy and Systems Research, for bringing us all together this afternoon to discuss such an important topic. Maraming salamat po sa inyong lahat, and I wish you all the best, and I hope to see some of you around sometime, kasi sa Zoom lang tayo ngayon. I really look forward to continuing this conversation in person when we have the opportunity in the future. Thank you very much. Magandang hapon.
Salamat po, Dr. Carlo, for those closing remarks, and also for emphasizing the important points that were discussed during the panel discussion. For always extending support on our initiative at HPP UPLIFT. Again, thank you so much to Dov, to Dr. Migo, to Dr. Alvin, for your precious time and insights during our panel discussion today. We hope from our 82 participants, you were able to learn more about how we're doing these initiatives at the health system level, at the local level, and also at the regional level. So before we end, we'd like to ask everyone to answer the evaluation form before the event. For the event, you may access it by scanning the QR code or clicking the link to be sent by the team members through the chat below. So I think nakapag-chat na ang team ng forms for the survey form. Please take note that this is a prerequisite to receive your certificate, and this form will be closed by April 8 tomorrow, 12 noon. And of course, do follow HPP's social media platforms and subscribe to our newsletters to receive updates about the latest happenings of the program. Thank you once again, and have a great evening, everyone. Maraming salamat po sa